Hello everyone, from this video we will discuss about the radial nerve. Here from this picture you can see brachial plexus. Here the roots are emerging from the spinal nerves, and these are the trunks, upper trunk, middle trunk and lower trunk. Then anterior and posterior divisions arises from the each upper, middle and lower trunk is here. You can see the divisions here, and then uh, all the posterior divisions unite together. Here all the posterior divisions unite together to form posterior cord of the brachial plexus, and the anterior division of the lower trunk, anterior division of the lower trunk continue as the medial cord, and then two anterior divisions of the upper trunk and middle trunk continues as the lateral cord. Here you can see lateral cord, then posterior cord, and then you have the medial cord here. You already know the branches arising from the each cord. I'll quickly show you the branches. Here from this lateral cord you have musculocutaneous nerve and the lateral root of median nerve, then the medial cord, medial root of the median nerve and the ulnar nerve here. Then from the posterior cord, this is the radial nerve and this is the axillary nerve which goes around the surgical neck of the humerus. Then there are some other small branches. From the medial cord, you have a medial pectoral nerve here, then medial cutaneous nerve of the arm and forearm here. This is the medial cutaneous nerve of the forearm, and this is the medial cutaneous nerve of the arm. You can see the medial cutaneous nerve of the arm has united together with the intercostal brachial nerve, which is the T2 intercostal nerve, lateral cutaneous branch of the T2 intercostal nerve. Okay, then the in from the lateral cord you have there is another small branch which is lateral pectoral nerve here. So those are the branches that you can see in this picture. Um, it is a quick summary about the brachial plexus. Now we are move on to our main topic today, the radial nerve. Here you can see the a picture with muscles and arteries as well. Here this is the subclavian artery which is continuous as the axillary artery here. You cannot see posterior cord here because you know the cords are in relation to axillary artery. Lateral to axillary artery you have lateral cord, medial to it you have medial cord, and posterior to it, posterior to axillary artery you have posterior cord. Therefore this radial nerve in the axillary region is behind the axillary artery. Here the relation, most important relation, it is behind the axillary artery and it is anterior to the subscapularis muscle. Here you have the subscapularis muscle. It is anterior to subscapularis muscle and behind the axillary artery in the axillary region. The radial nerve is the largest branch of the brachial plexus. You have to remember that as well. In the axillary region, radial nerve gives off three branches. Those are one branch to the long head of the triceps muscle. You have triceps muscle in the posterior compartment of the arm. Then this radial nerve gives a branch to long head of the triceps muscle, to the long head of the triceps muscle, then to the medial head of the triceps muscle, as well as posterior cutaneous nerve of the arm. What are the three branches arises at the axillary level? They are a branch to the long head of the triceps muscle, then another branch to the medial head of the triceps muscle, then posterior cutaneous nerve of the arm. Those are given at the axillary region. After leaving the axilla, here you can see it is leaving the axilla, it enters into the posterior compartment of the arm. You can see it goes behind the humerus as well. It enters into the posterior compartment of the arm and then it goes in a radial groove. we called there is a groove called radial groove in the posterior aspect of the humerus. It goes in a radial groove with profunda brachial artery, which is a branch of axillary artery. Here from this picture you can see the radial nerve goes in the radial groove in the posterior compartment of the arm by accompanying profunda brachial artery. Here is the profunda brachial artery, which is a branch of axillary artery. Then at about lower one third of the arm, here about this region, it again enter into anterior compartment. From this level it enter again into anterior compartment by piercing the lateral intermuscular septum. Here there is lateral intermuscular septum, and this radial nerve pierces the lateral intermuscular septum and goes in or enters into the anterior compartment of the arm. In some books says it enters into the anterior compartment just above the lateral epicondyle. It is also correct. When the radial nerve is in the radial groove, or we call it as a spiral groove as well, it is when it is in the spiral groove, the branches are given to the lateral head and medial heads of the triceps muscle, and there is a muscle called anconeus. A branch is given to the anconeus muscle as well. What are the branches to the muscles? To the lateral head of the triceps brachii, then to the medial head, then to the anconeus muscle. Then there are two cutaneous branches which arise when the nerve is in the spiral groove as well. Those are lower lateral cutaneous nerve of the arm. Lower lateral cutaneous nerve of the arm. That means here this is the lateral side of the arm. It gives lower lateral cutaneous innervation to this area. Lower lateral cutaneous nerve of the arm. And also it gives posterior cutaneous nerve of the forearm. To the forearm it gives, here you can see the branch, posterior cutaneous nerve. I told you earlier, in the axillary region it gives off 3 branches to the long head of the triceps brachii, to the medial head of the triceps brachii, and cutaneous branch to the posterior compartment of the arm. There are 5 branches when it is in the spiral groove. Those are one branch to the lateral head of the triceps brachii, then another branch to the medial head of the triceps brachii, then to the anconeus muscle, then 2 cutaneous branches, lower lateral cutaneous nerve of the arm and posterior cutaneous nerve of the forearm. So up to this level, there are 8 branches which has arise from the radial nerve. I told you earlier the nerve pierces the lateral intermuscular septum and comes to the anterior compartment of the arm in the lower end of the humerus. After coming to the anterior compartment, it gives branches to brachialis muscle, brachioradialis muscle, extensor carpi radialis longus muscle. And also it gives articular branches to the elbow joint as well. What are those 4 branches? To the brachialis muscle, then to the brachioradialis muscle, then to the extensor carpi radialis longus muscle, and articular branches to elbow joint. Here you can see the radial nerve has come to the anterior compartment of the arm and it enters into the cubital fossa. Here you can see. Here this is the brachialis muscle. This is the brachialis muscle, and this is the brachioradialis muscle. After giving branches to brachialis, brachioradialis, and extensor carpi radialis longus muscles, radial nerve divides into 2 branches as superficial branch and deep branch. Here you can see the deep branch of the radial nerve, and here this is the superficial branch of the radial nerve. Superficial branch of the radial nerve goes in the anterior compartment of the forearm underneath of the brachioradialis muscle and it supplies it gives off cutaneous innervation to the dorsal and lateral surface of the hand. Here, the radial nerve divides into two branches at the level of lateral epicondyle. Here, the two branches are given at the lateral epicondyle of the humerus. Then the deep branch. Here is the deep branch of the radial nerve. This winds around the neck of the radius within the supinator muscle and enters into the posterior compartment of the forearm. Deep branch of the radial nerve winds around the neck of the radius within the supinator muscle. Here is the supinator muscle, and it enters into the posterior compartment of the forearm. Here you can see the radial nerve, and it has divided into two branches as superficial branch of the radial nerve and deep branch of the radial nerve. Here is the posterior compartment of forearm. Here, when it enters into the posterior compartment of the forearm, the nerve descends by accompanying posterior interosseous artery. Also, it descends in between the superficial and the deep group of muscles in the posterior compartment of the forearm. Deep branch of the radial nerve give branches to extensor carpi radialis brevis. Previously, radial nerve gave a branch to extensor carpi radialis longus. Now, deep branch of the radial nerve gives a branch to extensor carpi radialis brevis and supinator muscle. After passing the lower border of the supinator muscle, here, after passing the lower border of the supinator muscle, this deep branch of the radial nerve continues as the posterior interosseous nerve. This posterior interosseous nerve accompany posterior interosseous artery in the posterior compartment of the forearm. You can see. So, the posterior interosseous nerve give branches to extensor digitorum muscle, extensor digiti minimi muscle, extensor carpi ulnaris muscle, then deep muscles, abductor pollicis longus muscle, here abductor pollicis longus muscle, then extensor pollicis longus muscle, then extensor indicis muscle, extensor pollicis brevis muscle. Then it also gives articular branches to the wrist joint and the carpal joint. Here is the cutaneous distribution of the superficial branch of the radial nerve. The superficial branch of the radial nerve is the direct continuation of the radial nerve after its main stem, and it rises at the in front of the lateral epicondyle. I'll show you previously, and it runs down under cover of the brachioradialis muscle on the lateral side of the radial artery. In the distal part of the forearm, it leaves the artery and it passes backward under the tendon of brachioradialis and reach the posterior surface of the wrist. Here you can see it has reached the posterior surface of the wrist. Here is the superficial branch coming from the anterior aspect of the forearm. Then it divides into terminal branches and supply the skin on the lateral two-thirds of the posterior surface of the hand. Here, in the dorsal aspect of the hand, it supplies posterior two-thirds of the hand. Here, posterior two-thirds of the hand. Here you can see in this picture as well. Here. Then it also supplies posterior surface over the proximal phalanges of the lateral three fingers. Lateral three fingers. Here you can see these are the lateral three fingers. This superficial branch of the radial nerve supplies posterior aspect of the lateral three fingers as well. Here is a summary of radial nerve. Here you can see the radial nerve coming from the posterior cord of the brachial plexus at the axillary level. Axilla, it gives three branches to the long head of the triceps and to the medial head of the triceps and posterior cutaneous nerve of the arm. And when it is in the spiral groove, it gives branches to long lateral head of the triceps, then a medial head, then to the anconeus muscle, then to the lower lateral cutaneous nerve of the arm, and then posterior cutaneous nerve of the forearm. Then after leaving the um, spiral groove, it enters into the anterior compartment of the arm at the lower end of the arm, and there it gives branches to brachialis, then extensor carpi radialis longus muscle, and articular branches to the elbow joint. Then it divides at the lateral epicondyle level into two parts as superficial branch and deep branch. Then the superficial branch goes in the anterior compartment of the forearm and descends downwards, and then it supplies to the dorsal uh, two-thirds of the dorsal aspect of the hand, skin, overlying skin over the dorsal aspect of the hand. And the deep branch of the radial nerve winds around the neck of the radius and in the supinator muscle, and gives off branches to extensor carpi radialis, brevis muscle and supinator muscle. And when it is go beyond the lower border of the supinator muscle, it becomes posterior interosseous nerve of the forearm, or posterior interosseous nerve. Then it descends further downwards by accompanying posterior interosseous artery in between superficial and deep muscle layers of the extensor compartment of the forearm. There it gives off branches to the extensor digitorum muscle, then extensor carpi ulnaris, extensor digiti minimi, abductor pollicis longus, extensor pollicis longus muscle, extensor pollicis brevis, extensor indicis muscle. And it terminate at the level of wrist joint. The posterior interosseous nerve terminate at the level of wrist joint. Now we are going to learn about the radial nerve palsy, or what happens when the radial nerve is damaged at the different levels. Here you can see the level of wrist joint. Here is the wrist joint. Here is the extensor compartment of the forearm. And here you can see the tendons of the muscles in the extensor compartment of the forearm traverse wrist joint. So the wrist extension is maintained by these tendons. Wrist extension is maintained by these tendons. So imagine if the radial nerve damage at the axilla. Nerve supply to triceps muscle as well as all the muscles in the extensor compartment of the forearm is cut off. When the nerve damage in the axilla, then all the nerve supply is cut off. All the cutaneous nerve supply to the lower lateral area of the arm, then posterior compartment of the arm and forearm, as well as all the muscular branches are damaged when it is cut off, when it is damaged at the axilla. So when it is damaged at the axilla level, the elbow extension is disrupted, because triceps brachia is responsible for the elbow extension. And when the nerve damage, there is no supply, no innervation to the triceps muscle. Therefore elbow extension is lost. And also the wrist extension is also lost, because all these muscles are supplied by radial nerve, or deep branch and the posterior interosseous branches of the radial nerve. Therefore the wrist extension is lost, but you can understand there is prominent action in the muscles in the anterior compartment of the forearm. Then what happens is, when there is loss of extension, wrist is more flexed. We call this as wrist drop. I'll show you a picture later. When it is damage in the axilla, as well as same thing happen. Same thing happen like wrist drop is happen when it is damaged at the spiral groove as well, because after it goes through the spiral groove, it gives branches to this um, extensor compartment of the forearm. So when it is damaged at the spiral groove, innervation to these muscles is lost, and then wrist extension is lost, then wrist flexion is more prominent. I explained earlier when I discussed the cause of the radial nerve. The radial nerve gives a branch to extensor carpi radialis longus muscle. Here you can see extensor carpi radialis longus muscle attached to here. Radial nerve is the one which gives branches to this extensor carpi radialis longus. But this extensor carpi radialis brevis is innervated by the deep branch of the radial nerve, and the rest of the others are innervated by a posterior interosseous nerve. So, when the radial nerve damage after giving branch to this extensor carpi radialis longus muscle, that means at the level of lateral epicondyle, or after, the radial nerve damage at the level of lateral epicondyle, it has already given to a branch to this extensor carpi radialis longus muscle. So, there is no wrist drop occur, because this extensor carpi radialis longus muscle alone can extend the wrist joint. Although the other muscles are, although the nerve supply to other muscles are disrupted, this extensor carpi, this intact extensor carpi radialis longus muscle alone can extend the wrist joint. Therefore, if the radial nerve damage after giving a branch to extensor carpi radialis longus muscle, you cannot see a wrist drop. Those are the main important things you have to learn when the radial nerve lesion occur. You have to remember uh, at which levels radial nerve damage occur. You can see wrist drop. This is the wrist drop. I told you earlier the flexion of the wrist is more prominent because wrist extension has been lost here. But if the radial nerve damage after giving a branch to extensor carpi radialis longus muscle, it alone can extend the wrist joint. Therefore, you cannot see wrist drop in that level lesion. I hope you guys understand the radial nerve cause and the branches and the relations of the radial nerve, as well as what happens or what are the signs that you can see when the radial nerve damage occurs. So thank you for watching.